These are all the common mistakes that have been made in Australia for the last 13 years for me. So, not treating the infection component all at the same time as the autoimmune component at the same time. Not treating long enough, yes, no. That's exactly what happened to me, not treating long enough. IVIG was not given. I was gaslit at Concord Hospital by the so-called experts there. They told me there's nothing wrong with me. Sent me home. I had a marker, previous GAD 65 in America, but because my GAD was negative, my amphotericin and IgG, which you can see soon, Dr. Frid talks about in her paper here, is all to do with what's happened to me practically. Define autoimmune neurology. Infections-induced autoimmune encephalitis. Talk about infections. No one's talking about this in Australia. If you have a tick infection or multiple co-infections, they will ignore you. Central nervous system causing autoimmune encephalitis. Yep, anti-neuronal antibodies that affect. Here in Australia, if you have any psych symptoms at all, they will gaslight you. They will deny care, and they will deny the autoimmune anti-neuronal antibodies are serious. Concord Hospital is a beauty for this, and so is Westmead, and so is Royal North Shore. They all work together to do nothing. Condition is infectious induced, not post-infectious. Co-infections, they can be just as nasty as the Lyme, the relapsing fever. It doesn't have relapsing fever here, but there are many strains of Borrelia. My daughter has Borrelia miyamotoi. I have Borrelia guerinii and miyamotoi. There's relapsing fever strains. There's more than Lyme. Our government in Australia is using semantics to deny care, and people are progressing to late neurological stages. It's a disgrace. My life has been destroyed by the Australian government, the New South Wales health system, and the DISCAT guidelines. I worked for New South Wales National Park. I went to work to protect the bush, and I have been destroyed by neglectful medical care, delayed care. Neurological manifestations of human babesiosis. My GP called me up the other day and he said the PA hospital, they've done a babesia test, but they haven't even told him what test they did for the babesia. It doesn't even say it clearly what they've actually done. In all the IGeneX tests, there's more than one test. They do several to determine whether you have babesia, because it can be a small component of your body, apparently, according to Omar Morales. Dr. Morales, the hematologist, and Dr. Stephen Harris, can still be causing problems. It can be in your brain. It can be in connective tissue. It can be hard to find. One smear can miss it easily. You need serology as well. Bartonella-Henselae presentation. This is one strain of Bartonella. If you look at my IGeneX test, they test for 10 strains. Australia only tests for 2 strains. Neurological manifestations. These are not being considered in anyone with a tick-borne disease history in Australia. No one. Here's one on sinusitis. Improvement of psychiatric symptoms following treatment. One needs to identify all the infections and treat them all at the same time. This is complicated. This is why they turn us away in Australia. This is why they deny care. This is why I have been torn from my daughter who needs me, and I don't think I'm going to make it. Sadly, I don't think I'm going to make it. I'm that destroyed. I'm that much of a shell of a human now. I don't even know what type of life I can have. I can't walk. I can barely hold my head up. I'm now relying on almost full-time carers. The last 8 to 9 weeks, I've declined that much. Identify all co-infections. That won't happen in Australia. Decline in memory. You're a 33-year-old woman and you decline in memory, psychiatric symptoms, aggression, inappropriate sexual behaviours, panic attacks, compulsive euphoria or fear. All these are used against you to deny care. Gait, limb movements, eye movements, swallowing, all this is happening, yet They ignore everybody. Rigidity, jerking. Autoimmune disorders. This is what follows. Not treating the tick-borne diseases properly. And here we go into the next. This is a checklist no one will do in Australia. There's none of this. None of this is happening. None of it. A bit small to read. And here we go into workup for an autoimmune encephalitis. So GAD65, you can see there, positive for me in America, denied in Australia. Denied all my symptoms of worsening. Gaslit. I was walking when I got back kilometres. Now I can't walk at all. It all could have been avoided. Amphicyon and IgG, positive in me as well 3 times. Paraneoplastic panel. So the infections drive these autoimmune markers. They're horrible. They attack your central nervous system and your spine. So I had a neurologist finally try and help me in Greenslopes and gave me IVIG, but it just wasn't enough. The infectious disease doctors do not work with him, and there's no one working together. There's no multidisciplinary teams. He was a good guy, but he just, without a team together on this, you just can't treat it. GAD65. My carers has got sick of taking me to the emergency room after reacting to the IVIG, which you can later read. And Dr. Harris, as he explains, his tick-borne disease patients will react to the IVIG if the infections aren't treated. So, you know, they just blame your immune system. They blame this. Oh, you're acting. They will take that away. No, the IVIG would help if they actually treated my infections, Dr. Harris said. So, and clean my blood first. That's been delayed 4 years. QBE have tried to sabotage me getting my blood cleaned for 4 years. I've done a very good job of it too. Infectious disease doctor in Brisbane, they wrote to, didn't even give her my full history, and she said, well, I declined. That's because if you look at the treatments for the stiff person and the encephalitis at Johns Hopkins, they say maintenance must be followed up. None of it was followed up. Again, patient blaming by infectious disease. That was Dr. Georgina Hale, by the way. And I want this to all go viral in the case something happens to me. These people need to be called out. They're not good people. They're not ethical. They're lying to Australians. They're hiding behind faulty tests. How do you treat it? That's not happening in Australia. I'm getting plasmapheresis tomorrow finally because someone's seen how bad I'm getting. However, infectious disease are going to let us down again, no doubt. 4 years, treat all the infections at the same time. Who's going to do this for me? Infections induced autoimmune encephalitis. There we go, back to common mistakes. If only I'd had Dr. Frid and I'd been in America. I'm just being born into the wrong country and did the wrong job. But I'm doing this for my daughter because she's going to need help one day, and this rot has to stop. This rot and these infectious disease doctors in Australia, they are corrupt. They have got no ethics. They are hiding behind faulty tests. So then we go back to... Okay, I have to put all this back together. My care and help with that because I've got so much inflammation in my body. Here's one of my German tests. Interleukin 6 is 6,222.7. Normal is less than 5. I'm in. Dr. Monif from Monash University is studying now interleukin 6 on the effects of autoimmune encephalitis. Nobody else is looking at this in Australia. They're just going to gaslight people for being infected. These are the effects of my spine. This is what this infection did to my spine. No one's even explained this to me yet. This was 2017. This is Dr. Frid. I saw Dr. Frid in 2018. She sent my blood all around New York. I can show you the results coming up in the back. She, in 2021, suggested plasma exchange, 4 to 6 exchanges per month, followed by and agreed with IVIG, blah, blah, blah. But down the bottom, she's also got treating the infections, same as Dr. Harris. So this is what the Americans do. They actually treat the infections. They don't gaslight their patients. Dr. Harris, so here's the stiff person guidelines from John Hopkins. Spectrum disorder, my markers are in this. By Dr. Scott Newsom, but unfortunately he doesn't talk about infections people have from tick-borne disease. He does recognise the autoimmune markers and some of the treatments. And he also puts in that it needs to be maintenance, not stopped, like Australia. Here we have Dr. Stephen Harris. So my Bartonella test came back positive. They test for 10 strains, unlike Australia tests for 2. But Babesia, treatment, there, Criftonel, no. Can't do any of this because I don't have anyone to supervise it. Dr. Harris's letter recently in, it's not dated, I don't think. Yes, it is. So he wrote this the 9th month because it's backwards because it's America. So he's practically saying in here the infections I've had and got, several Borrelia species, Borrelia, GAD, and then he's saying plasmapheresis, IVIG, autoimmune encephalitis, sorry about my brain because it's not good and so much pain and my neck is killing me. IV Remixatab for the management of autoimmune encephalitis if antibiotics administered for chronic infection coverage at the same time. So they wanted to give me Remixatab. The doctors at PA Hospital Infectious Disease, Letitia Gore and her gang, wanted to give me a Remixatab when I still have active infection. It's very, very dangerous. And this from Dr. Harris. Dr. Harris, who I trust far more than PA Infectious Disease, who have no idea and have no complex cases of tick-borne disease because they ignore everybody. So here's another one from the MARTA. They turned me away too. Got all these weird stuff happening. Rare myelocytes seen. Reactive lymphocytes. Here's my recent Babesia. Sent my bone blood to America. I paid for myself again. 80. I'm bedbound now, so this is all I can do to help myself to try and fight. But I'm losing hope. So 80. Babesia Duncan. Previously in 2018 it was 1 to 256 titer. It was in, I'll show you how many percent of my red blood cells when I went to Mexico for the plasma exchange and the red blood cell exchange. So, which I paid for selling my house because QBE wouldn't do it. And QBE are hiding behind the Australian health system, which is an absolute failure for tick-borne disease. They're using it to their advantage. So, and the medico-legal is just as bad. Bartonella species, so if you look here, there's like 10 species here they test for positive. Okay, IgG, but Dr. Harris, I've got a written thing up, he's still positive. Here is persistence, it's 30 pages, peer-reviewed, persistence of Lyme disease, spirochetes, Borrelia burgdorferi, and tick-borne disease. So this is all Borrelia, not just Lyme, it's all Borrelias, relapsing fevers included. So these are now my CD counts, the worst they've ever been back in Australia. Too long. Panlymphopenia, non-diagnostic because they don't know what's causing it. They have no idea. It's the worst my bloods have ever been. This is my GAD from America. Autoimmune encephalitis diagnosis. Here's my anthocyanin IgG, which was mentioned earlier, Dr. Frid's. Here it is here, written up easier. My markers, autoimmune encephalitis markers, which I ignored in Australia, including Concord and Westmead. Here's my DNA, my blast, DNA sequencing, and it comes up to, you can see there, I've got Borrelia burgdorferi in this sequence. 100% match. 100%. No doubt at all that Borrelia burgdorferi is here and the government is lying to us. They also shut Jenny Burke, Australian Biologics, down. She sent my blood away to be sequenced. Here we go. Here's another. A lot of my tests show up. I've never had any bands not show up. They always showed up something. So this is like IGNX positive 31, 41. So it's IGNX positive. This is with a very poor immune system. These are just some of my rashes and anaphylaxis and vasculitis. This is all like the last 4 years in Australia. Dr. Harris had me all going really good actually compared to what I am now. So, and this is crystal structure of outer surface protein OFC. You'll see this come up later in my German test. OFC, which means you've been infected with Borrelia. Here we go. So, Borrelia burgdorferi IgG, positive. IgM, positive. This is 2021. Oh, sorry, 2020. Jeez. So, that's how long I've not been treated for. So, no wonder I'm declining. Really, really bad to let someone suffer like this and let them slowly die neurologically. It's unbelievable because I had a national parks friend die the same way and I know what way I'm going because I'm starting to lose my ability to swallow and everything. Borrelia ezephali guerini IgG positive, high positive. This is Army Labs. It's an internationally accredited lab which our government are ignoring. Far better tests in Australia. Superior. I'm in the dark because I can't stand any light. It's my encephalitis. I've also come up to enteroviruses. So you get reactivated viruses a part of the Borrelia immune suppression. So the fact they want to put rituximab into me and I'm immune suppressed and autoimmune at the same time is just crazy without protection of antibiotics. So my mycoplasma co-infection is still there and quite high, IgG. Here's my IGNX for 2019. It shows relapsing fever. Positive, relapsing fever. We don't even have this test in Australia. It's in our ticks, relapsing fever strains of Borrelia, but there's no test in Australia. That's the way the government wants it. And here's some round bodies. So, Borrelia, ezephali guerini round bodies, weak positive. So it's another test that they do. We don't have these tests. These are far superior to any Australian tests. The infectious disease doctors here just belittle these tests. The arrogance while they're letting people die is just, it's astounding. And here we go to Borrelia immunobot, positive IgG. I've got a lot of positives on this one from Germany. It's because it was off the back of America and my immune was still trying to fire. So it's dropped my CD counts as well. They were better then though. They were like in a range that was better. Now they're really bad. So CD57 is very low. The CD3 counts are different, you know, they're still lowish, but they're not as bad as they are now. That was 2021. How to treat it. We went through that. Treat all the infections at the same time. Chronic Lyme is a wrecked immune system. This isn't just Lyme. This is all the Borrelias. This is all the neuroborreliosis. And here we go. Back just to some of my tests. The 30, 31, 41. This was Dr. Main, who they actually deregistered because he brought out the truth. And now this is what's happening to my bloods. Non-diagnostic pan, lymphopenia, and all my CD counts are really, really off. I'm going to have to try and let some light in because I can't see anything. That's just my CD counts. They're not good. No wonder, because I'm just on fire and burning and my tissues are not functioning. I'm just like going into ketosis all the time. And there's just another aspergillus, which is high-ish, but not too high. It just shows I've got had mold in my body, got mold in my body. And just can't share to get rid of it because I'm sick. My bloods are not good. Blood's just not good. All in the red. Red. Lots of red. And here's my Babesia. We're talking about Babesia duncani, 1 to 256 titer. It's hard to see, but that's 1 to 256 titer. That was 2018 New York. Dr. Elena Frid sent around to all the labs where the US military get their tests done. Also chlamydia pneumonia, which becomes chronic, which also needs treatment. It's treating all the infections at the same time, like Dr. Frid said in her conference thingy. Oh, and that's just my Babesia positive and Bartonella positive. This is the staph infection. They let me go septic with 3 staph infections, normal CRP and no body temperature because of my wrecked immune system, which was mentioned back there with the truth cures. And then we get reactivated viruses like Epstein-Barr, which become part of the problem. So we are very complicated, and that's why they're ignoring us. So they prefer to ignore us with multiple co-infections, viruses, reactivated viruses, because it's easier to ignore us than help us. And it's easier to let people slowly die because then they don't have to pay for it. Insurance companies don't have to pay for it. Chlamydia pneumonia, common co-infection with Borrelia. We just can't shake it. Here we go. These are from 2009, after the tick bite. My last tick bite, I didn't work again 4 days after the tick bite, National Parks, on my neck. So I come back weekly positive then to bands. P83, P30 at that time. And yeah, so at the time, the immunologist rang up Germany for me because he didn't understand all this. He actually admitted it. And he said I had late-stage neuroborreliosis. Toxaki's there as well. Chlamydia and mycoplasma is constantly there. And they want to give me rituximab when I have all this because they just want to ignore it. It's unbelievable. Unbelievable what they're doing to people in Australia. It's just genocide. We could have had lives. So here's my test from Dr. Elena Frid that she sent. So I've got IgM band 39 present, 41 again, 39, and 30. There's quite a lot of bands coming up there. Mycoplasma is high. The other co-infection. Epstein-Barr positive. Reactivated viruses that also need treating. They can cause encephalitis, autoimmune encephalitis. And here we go to microscopy report from Dr. Omar Morales, Lyme, Mexico. 11% and 7% of my red blood cells are infected. That's a very high rate. So this was 2018. That was the first trip, the short trip, when I had the plasma exchange and summer treatment and testing. And then we went straight to New York at the time, straight after that, for more diagnostics, just to double check. So that was Omar's red blood cell exchanges. Not red blood cells, sorry. Red blood cell smears. And then the 125 ticks titer. The week after, the BCR. Here's the date. Was it the week after? Or it wasn't too long after. 2018, 5th, 6th, Babesia, 125 ticks titer. Quite high. We go back to Omar's. Go back to Omar's here. Omar's is, what date was it? Date. I think it's got the date on it, has it? Oh, yes, it has. 29th to the 10th, 2018. 29th to the 10th, 2018. Wasn't a week after. My brain's not working completely. So frustrating. This is just so frustrating. If my brain worked, I would have had these guys. 30th of the 4th. I can't get it. My brain's not working. Anyway, I went from Mexico to New York, and they both said Babesia for Australia. No idea. So Dr. Raul Morales is his father, head hematologist. He also oversaw that. Here's just another one from Dr. Frid. This one just showed 2 bands showing up. And the next one was like 4131 again. Here's my DNA. Nested PCR, whole blood, Borrelia positive. Confirmed by sequencing DNA. That was the DNA blast you saw before. That's just in tests. Multiple reports here. This is the second sepsis report that could have been avoided if I was treated properly and managed in Australia. Ended up in Royal North Shore. Then they threw me out with my autoimmune, ignored my autoimmune, wouldn't treat it, and still had persisting Borrelia infections. Ironically, Dr. Bernie Hudson, who works at Royal North Shore, just didn't want to help me anymore because it all got too difficult. And they're all just, it's unbelievable. So here's my Royal North Shore, the positive PCR were Lyme in the blood, April 29, notwithstanding doubt, can be taken to mean that Natalie is infected with the causative agent of Lyme disease. Consequently, she can be regarded to having Lyme disease rather than a Lyme-like illness. Dr. Bernie Hudson told me I'd be okay. Guess what? I'm not okay because I didn't get follow-up. I didn't get the right treatment. I got thrown out of Royal North Shore as well. This is me in Mexico, 4 months into treatment, from a wheelchair, not talking and walking. This is what people can look like if they get looked after medically. Sadly, now I have to film what's been happening the last 4 years because the country that let me down in 2019 that I had to sell my house to has done everything that they did for the first 10 years. I had some hope, now I don't have any. Septic patients presenting with apparently normal reactive protein. This was ignored as well. Journal of Spirochetal tick-borne disease, persistent relapsing babesiosis in immune compromised hosts talks about rituximab. You shouldn't give it to people unless they're treated. Can't even get intravenous fluid when here you're dehydrated in this country. They treat you like a leper for your POTS and your dysautonomia. Dysautonomia. Don't know how to say it properly. And that's about it.